Go ahead.
I hope it's better. Yes, great.
Yes, sir.
So wonderful. So very good evening, everyone. I welcome I
Good
welcome you
evening,
all.
sir.
My name is Amit Mahanta. I am one of the career advisors here at ProTouch Professional Training. Before we start, let me give you all a quick overview about ProTouch. ProTouch is the certification institute which provide upskilling courses to the professionals like HR generalists, HR analytics, POSH trainer certification program, business analytics for manager certification, corporate trainer and facilitator certification program, emotional intelligence trainer and coach certification. We also provide customized programs, and all of our programs are accredited by the topmost bodies like ICF, International Coaching Federation. Then there's SHRM, Society for Human Resource Management, HRCI, Human Resource Certification Institute, and CPD, Continuing Professional Training. And I'm very glad to see many of our existing participants, my team members, and aspiring students of ProTouch who have joined our training session today. So, before we begin, I would like to know from the audience, how is the weather at your respective cities? You can use the chat box or you can unmute yourself to answer.
It's showery in Mumbai.
That's great. It's also, Amit mentioned it's raining in Bangalore as well.
Right.
Not good, it's very hot. Same here in Delhi with us, raining in Hyderabad.
And Jharkhand, it is very hot.
Same here as well in Delhi NCR. Thank you so much, everyone. So now let's begin the training session with Amit S. Pokharnikar, our guest speaker for today evening. So I would like to take a moment to introduce everyone to our guest speaker, Mr. Amit. Amit comes with 17 plus great years of experience into learning and amplifying leadership development that is related to healthcare sector at Aster Health Academy. He's also a grievance officer at Aster Group India and working with leadership development for internal and external engagement in healthcare. He is an alumni of Tata Institute of Social Science. Prior to his experience at Aster DM Healthcare, Amit worked with HCG and CRISIL. So welcome everyone, Mr. Amit.
Thank you, Amit. That was fabulous on your part.
You're most welcome. Amit, the
Hello.
stage is all yours. We can start.
Okay, okay. I thought you were saying something because I couldn't hear anything. So, good evening, everyone. I hope everybody is fit and fine in their respective cities. The weather is there always, and I think it brings a lot of charm in terms of what weather we are experiencing in whichever part of our country we are. So, currently, I'm having this particular location in Bangalore, and I was supposed to travel, but then I had this opportunity. That's the reason I thought maybe I should take this call from Bangalore. Nevertheless, look forward to interact with all of you all. And as all of us we are aware, today's topic is to understand what are the best practices in terms of learning and development in healthcare industry. Now, I have a small presentation that I have created for this particular session. I'll quickly share the deck. Let me know once everybody is able to see it. Is it visible?
Yes.
Hello?
Yes,
Yes,
sir.
sir.
Yes.
Yes, sir.
Perfect, perfect. So, the context of today's discussion, although it is related to learning and development, but since we are looking at healthcare industry, because the industry itself is different from other sectors, the expectations might be slightly different in terms of what usually might happen in learning and development space within, let's say, IT industry or within services industry as compared to healthcare, because healthcare is very specific in terms of the services that it offers. And essentially in healthcare, as we all understand, when we talk about healthcare, we are relating it with hospitals. It might be diagnostic services which are provided by hospitals. It could also be affiliate services related to hospitals such as pharmacy, etc. But everything is part of healthcare. Now, before we start with the actual presentation, I would love to understand from all of you all, what do you see in this image? What do you all see in this image? You can unmute yourself and you can give your perspective. What do you see? Anybody?
A girl with
And
her head turns backward.
Okay. Okay.
and the old woman.
Okay.
A
Old
girl is
woman.
a girl is wearing a jacket.
A girl is wearing a jacket. Very nice. How about others? We have so many participants, 40 plus participants.
I see a
Feel
girl
free
with a
to.
feather.
Girl with a feather. Okay. So somebody mentioned that there is an old lady. Most of you all are saying there is a girl. So what's exactly correct in this picture?
There are two pictures if you want to see. So there is a picture of girl as well as an old lady.
Perfect. Perfect. So thank you so much for that answer. But often what happens is the way we look at a particular situation, it could be from our own perspective. And this is where perception comes into play. Now, why I have this particular image on the slide is because when we talk about healthcare industry, unlike any other industry wherein, like, let's say if you talk about IT industry, their products, their services are very specific. But when it comes to healthcare industry, especially hospitals, people who come to us for treatment, they have their own perspective. They are coming to the hospital for treatment. They don't know what the outcome of the treatment could be, and these days the cost of treatment is on the higher side. So even after paying the amount for the treatment, patients, their family members are not convinced what might happen eventually. And that's where perception plays an important role, especially when we talk about how we create a positive ecosystem within the hospital, within the affiliate entities, so that every time a patient comes to the unit, it has, I mean, the patient has a positive work experience with us. At the same time, when they go away after having the treatment, they talk positively about the organization. So perception is very important. Now, how this is related to learning and development? Learning and development, training department, capability development, all these departments, we have to focus on ensuring that the way a customer or a patient who comes to the center or receives the service, every time they come to us, their service is always as per their expectation. And this is where perception matters, because unlike other industries, the key factor in healthcare industry is an element called as empathy. Have you all heard about empathy? Have you all heard
Yes,
about empathy? And what does
yes.
that mean? What does empathy mean?
Putting yourself in your clients or customers or your patient's shoes and think how you will feel about the same situation.
Perfect, perfect. Thank you for that answer. And what is sympathy? Is it same as empathy?
No, not at all. It's different. Sympathy
Okay,
means consoling someone. Giving, showing compassion about the situation others is facing. The if anyone has faced a tough situation, then consoling that person or um, giving him
support.
support, emotional support, primarily it's emotional support that we provide. That is what we call as sympathy to some extent. So that is
Thank you so
different, very
much.
different from empathy.
And what is apathy? Apathy. Apathy, or at times people pronounce it as apathy.
Realizing the situation yourself. I mean, it's like empathy. I'm not sure about it, but just guessing it to some extent. Empathy means what you are facing. I am consoling you, or I am putting myself into your shoes to understand the situation better. Apathy is when I'm myself facing the same situation.
Not
If that's
exactly.
same. Right,
Oh,
right,
okay.
right. I
Any,
just
not
It's
a
a,
problem.
a it's a lack of concern or interest, I can say.
Perfect, perfect. So, like, let's say you're going to a particular place, you see an accident that has happened on the roadside. You feel sorry for the person, you approach the person who has met with an accident, and you try and help the person to, let's say, ensure that the person gets the treatment that is required at that particular point of time. So this is empathy. However, let's say you look at the person, you feel sorry, you feel bad, and you drive away, but probably you might ask your friend to go and support the person, or you might keep thinking about that person. You are affected in some way emotionally. So, to a greater extent, that becomes sympathy, because you're not trying to help the person directly, although you're involved in that particular process. On the other hand, when we talk about apathy or apathy, it is basically acting indifferent. You are not bothered about what's happening. Maybe you're busy, maybe you're getting late to reach office. However, considering the incident that has happened, which is about someone's life, and if you're not concerned about it, then definitely it cannot be called as empathy or sympathy. So it becomes apathy. You are acting indifferent. Now, the importance of this in healthcare industry is every person who works within the hospital setup, right from the housekeeping person, security person, till the topmost CEO, chief executive officer, or chief operating officer, all the people, we need to be empathetic towards the patient who come into the system. Because unlike other industries, as I mentioned, out here it's more about giving quality patient care to the people who come into the system. We should be able to feel their pain, and if we are able to do that, then we are in a position to provide them better service. If we act indifferent, then the challenge is people won't really connect with us, and these days people can always go to any other place wherein they feel they can get the best treatment. Now tell me, what are the various departments in a hospital? And then I'll try to explain why the first slide is the most important slide in terms of learning and development. What are the various departments that you guys are aware about a hospital?
Doctor, nurses, admin,
Okay, admin, very nice, very
IT,
nice. IT, perfect.
legal also there.
Okay, very nice. What else?
Emergency department.
Correct. ER. What else?
Accounts
ICU.
department.
ICU. Perfect. So all these, most of these that you all answered, they are related to, let's say, clinical side. What about the non-clinical departments? Do hospitals have HR?
Yes,
Do hospitals have marketing?
yes,
Do
Yes.
hospitals have cafeteria?
yes,
Yes, sir.
Yes.
yes.
Okay. So what I'm trying to highlight out here is, unlike any other industry, most of the support departments or supporting departments, they are also present in a hospital setup. But since for a particular healthcare setup or hospital setup, the major service that they're going to offer is about treatment, or it might be diagnostic, like let's say a lab facility, or it might be pharmacy related, wherein they are giving away medicines. So whatever it is, these are the products and services which the hospital is going to offer. But to ensure that the entire ecosystem runs, we do require various departments within the hospital. And these are some of those departments which are there in the hospital, which also act as touch points for the patient and the family members who come into the hospital. Now, out here, I would like to ask a question to everyone. Assume that you are going and visiting a particular hospital, maybe a friend of yours or a relative of yours is unwell, and
Hmm.
you go to a particular hospital that you are aware of. Who do you think is the first point of contact for you?
Reception.
Okay, okay. What about others? Would love to know what
The
you all
security
think.
guard, the first point of contact is
Okay, okay. Very
That is
nice.
the front desk or the PREs, patient relationship executives.
Okay, very nice. And who do you think would be the last point of contact?
Doctor.
Maybe the GM or
Doctor.
the CEO, right?
Okay. So that might happen if there are escalations, but again, that
Yeah,
probably would
definitely
be,
yes, no.
yeah, but then probably that might be second last or third last. So somebody answered as security. That's the correct answer, because let's assume you drive into the hospital premises or you walk, and the very first point of contact would be the security guard who is based out there. Now, let's assume the security guard speaks rudely with the patient or the people who are coming to the hospital, maybe because they park their vehicle at inappropriate place or whatever the reason could be. Now, if that's the case, which happens at the initial touch point or the very first touch point, the problem is patient and family members, when they come inside, they'll be having bad experience at the very first touch point. They will then go to, let's say, the reception area. If they are familiar with the hospital premises, the floor areas, etc., the department wherein they have to go, they might go and reach out to the doctor or the patient care coordinators out there. In all these scenarios, at every touch point, the patient and the family members are going to interact with people, or they might be observing what's happening in and around. If their experience is positive, they'll be assured that, okay, fine, this is a good place wherein they can take the treatment. If they are not having that positive experience, and then this kind of negative experience will always build on. And often what happens is there is a particular thought process which comes into our mind, which is called as moment of truth. Have you all experienced moment of truth? What it means? Moment of truth? Any idea? Can anybody answer what is moment of truth? So let's say you all go for shopping. I'll give you a parallel example. You all go to a particular mall and you're planning to shop. Do you think that you want to bargain at the mall? Can you bargain at the mall?
No.
And let's say you're going for street shopping.
Hmm.
Do you bargain out there?
Yes.
Yes, we can add.
And why is it so? Why
We-
you can't bargain at the mall? Nobody told us, right, that when you're going to the mall, don't bargain out there. But we ourselves have thought about it, right, in that way that we cannot go to a mall and we cannot bargain. So again, it's a perception. If you go internationally, if you go to, let's say, Thailand, if you go to Europe, especially London, there are malls out there wherein you can go and bargain in those shops or those outlets. Of course, they are not like the high end shops or outlets wherein you usually might go and bargain, but then there are. So what I'm trying to highlight out here is, again, it's about the perception. So for healthcare industry, the important thing is what you do. You might be the best, but every time there is a new patient who comes in, their experience may or may not be the same from your end, although you might be providing the similar service, because patient to patient, their problem, their concern might differ. As a hospital entity, as staff members, you might do everything in your capacity. However, if you're not able to fulfill the requirements of the patient and the family, although everything is correct that you did, still their experience might be inappropriate. They might not be happy about it. And these are some of those major departments wherein patients usually have, let's say, interaction, or they have touch points, or they interact with people who might be our staff members, who might be other, let's say, housekeeping people like HK or PCA, or it might also be people from cafeteria, the servers. So these are the people with whom patient and family members actively interact or might interact. Now, what is the correlation of this with L&D? There is a huge correlation. L&D in any hospital setup or in any healthcare setup, role of L&D department or training department is to ensure through training programs, every time a patient and a family or even our internal stakeholders who are part of the hospital fraternity, they always have positive work experience, or they always have positive experience in terms of services that they are availing. And this is where L&D in healthcare setup becomes slightly different from other industries. In other industries, we technically do not talk about empathy. L&D is there in all the sectors in whatever capacity. The team size might be greater, the team size might be very minuscule in terms of how big the headcount numbers out there might be. However, in healthcare industry, every intervention that we do in terms of training, be it technical training, be it soft skills, behavioral leadership skills, we have to think from different touch points. At every touch point, what is the possibility that the patient or their family member might experience negative experience? And that's one of the crux of healthcare industry. Now, what is the importance of learning and development in healthcare industry? Lot of importance is there. If you look at the past 60 years of, let's say, hospital sector, healthcare industry in India as well as internationally, you'll be able to see lot of difference. especially in the last 3 years time period post COVID. Importance of L&D or training has grown exponentially, because during lockdown most people were working from home, and that's when lot of edutech companies, lot of e-learning interventions came into picture, and same also happened in healthcare sector. But if we look for, let's say, last 60 years or last 100 years, the growth has been very slow. There were interventions earlier also, there are interventions now also, but the greater emphasis for L&D in especially healthcare industry has picked up in the last 5 to 10 years. And considering the technology that we have nowadays, it is becoming more and more important. Now, in terms of types of training which are very prevalent in healthcare sector, it can be classified in two categories. The first one being technical. When we say technical for healthcare setup, it would be largely clinical if it's a hospital setup. Along with that, there could be other departments, as we discussed earlier, support departments like, let's say, stores and purchase. So, whatever technical training with regards to, let's say, using a particular software, using a particular ERP system, those would be technical trainings. Similarly, doctors, nursing staff members, for them, their technical training essentially would be clinical training. People who are working in finance, their training would be with regards to, again, financial software, Tally software, for example. For HR, it might be SAP, it might be HRMIS systems. And when we talk about non-technical, it would be anything that is non-clinical. It could also be mandatory trainings. It could also be soft skills and behavioral skills. I'll take a pause out here. Are there any questions so far? Are there any questions so far? Anyone? Hello? Am I audible?
Yeah, Amit, one question from my side. What are the focus group in healthcare sector you focus for L&D? I mean, whether the clinical, non-clinical, technical, non-technical, you segregate them for the L&D, or in a how do you segregate them if you're doing it?
Okay, okay. So that's a good question. So I was about to explain on the next slide how the process happens. But since you have asked this question, I'll explain. So let's assume we are in the month of April. So every year, the financial year starts from 1st of April and ends on 31st March of the next year. So as is applicable in other industries, similar in healthcare industry largely, we start with identification of training programs in the month of April. By then, we are almost through with PMS process for the previous year. So when we start with need analysis, or let's say training needs identification, there are multiple ways in which we get the data. So there might be a survey that is circulated with all the employees. Second input would be in terms of CSAT scores, that is customer satisfaction scores. Third input would be in terms of net promoter score. So every patient who comes into the hospital, who undergoes treatment, on the day of their discharge, we do take their feedback. And that's how we also try to gauge what are the various outcomes in terms of our services. What service patient liked, what service patient didn't like, and whatever they didn't like or their experience was bad, can those parameters be addressed by providing training? Because technically what happens is you can't address all the problem areas through training. So that is one part. So once we do this particular analysis in terms of training needs analysis, the survey, the data, the input is taken from all the departments within the hospital. Now I'll just give you a brief about how the broader bifurcation of headcount within the hospital would be. So let's assume there would be, let's say there is a hospital wherein there are approximately 100 employees working within the hospital. In any hospital setup, essentially around 30, 35, in some hospitals it would be as high as 40, 45% headcount would be with regards to nursing staff members. Around similar count, 30, 35, or let's say up to 35 to 40% would be with regards to operations. And the remaining portion would get adjusted among medical or clinical doctors, then the support departments like HR, stores, finance, MRD, and multiple other departments. So essentially, most of the headcount would be in nursing, and the other portion would be in operations. Now, to answer your question, whenever we do need analysis, it's for the entire organization. So, when we talk about focus group, each of the departments would be the focus group. However, within that, the major emphasis is for nursing department because they are the frontliners. When I say frontliners, I'm referring to they being the ones who are always in direct touch with the patient or the family members who come into the system. Also, we have doctors, also, we have operation staff members. So, they are the primary focus groups. Now, for nursing, as I mentioned earlier, for them, the technical training programs will keep happening. So those are with regards to their core work activities that they need to do. However, when we talk about non-technical, it would be soft skills, it would be behavioral skills. If somebody has joined newly, then again there would be induction trainings, mandatory trainings, and so on. So focus group would be everybody. However, the priorities might vary across the department. So if you say, for example, what would be the priority to train security staff members, housekeeping staff members? Priority would be on the lesser side. Do they need training? Answer is yes. So everybody would undergo training. Excuse me. Everybody would undergo training. However, periodicity and the extent to which they would undergo certain developmental programs or training programs that would differ. I hope I have answered your question. Hello.
Yes, Amit. Thank you so much.
Any other question? Anyone? Okay. So I was talking about non-technical. So all the trainings which are of, let's say, non-technical nature, like as I mentioned, clinical in terms of doctors, in terms of nurses, in terms of your process, non-technical, anything that is like, let's say, mandatory training, let's say fire and safety. It's a mandatory training. So that essentially gets categorized as non-technical. It could be behavioral, it could be soft skills, it could be leadership development. Often among hospitals, we do have a particular program called as NLP,
Hmm.
Nurse Leadership Program, or some hospitals call it as Nursing Leadership Program. Again, that's a non-technical program, although it might have some elements of technical components of their work, but essentially it would be a leadership module. Now let's do one small activity out here. How many emotions are there? Can anyone answer this question? How many emotions do we have? Or let's say you all are aware of. You all can unmute yourself and you can answer this question. What are the various emotions? How many emotions do we have?
The
Many
infinite.
times.
Sorry?
Sir, happiness,
Approximately 25,
sadness.
20 to 25 emotions.
Okay, okay. And if I have to ask you which are those emotions, what would be the answer?
Like few
We have
commons are
nine emotions.
happy,
Sorry.
anger, anxiety.
Okay, very nice. So
So, you
someone
know,
mentioned nine.
Yeah, we
when we
have
talk
nine
about
emotions.
emotions, I would like to contribute here. That is, there are many, like a
Correct.
colors, you know. Uh, if we add sadness plus fear, it will be different. Fear plus anger
Fabulous.
is different. So there are so many, but when we say there are five basic emotions, and I generally put it in the word flash, because anything happens, one of the emotion gets flashed in that situation. Flash is F stands for fear, L stands for love, A stands for anger, S stands for sadness, and H
H.
stands for happiness, right? So that is how we generally keep it in mind that these are the basic five colors of emotions, and then it gets mixture with other.
Very well articulated. Thank you so much. Fabulous, fabulous answer. In fact, I loved the way you put it across. Flash. So, as rightly mentioned, psychologists usually they say there are eight emotions which are strong emotions. Some people say there are nine emotions. In India, we also say navrasas. So, in different contexts, people do say there are 8 to 10 different emotions. However, as rightly mentioned, what happens is during the day or during a certain time period, we are not in the same emotion. There might be ups and downs, there might be good things, there might be bad things. We might have baggages back at home, back in office. So a person goes through different time zones across different situations. And what psychologists usually say is, by considering all these emotions, the combination in terms of permutation combination could be as high as 75 to 80,000 combinations. Of course, a particular emotion might be on the higher side, a particular emotion might be on the medium side, lower side, that way. So the combinations could be multiple, but what essentially matters is how well we are aware about our own emotions. Again, this is more from emotional element, but when it comes to L&D, when it comes to the outcome of training programs in a hospital setup, especially when people or when the staff members, when they are going to interact with patients, our emotions need to be checked. So I'll give you an example. So let's say a patient comes to the hospital and the person at the reception desk, he or she is seated out there in a very blank kind of a look. The patient who comes in, the patient is not able to see any change in terms of what's happening at the front of his desk. The person is not very pleasing, person hasn't greeted the patient. Now the patient, he or she won't be happy about it, because the patient would be like, I'm a patient and still I managed to come to the hospital, and the hospital staff member, they don't even have the basic courtesy to greet me. And that's where they'll feel that there is disconnect in terms of emotion. So the number one thing that we train all our employees, especially in a hospital setup, is that every time there is a visitor could be a patient, it could be an attendant, it could be a relative, it could be anybody who is not part of the system, or even the person who is part of the system, we have to greet that person. And each hospital, largely, I mean, most of the hospitals which are there in the Indian context, they all have a greeting protocol. Most hospitals greet their patients or their staff members by saying namaste. And the basic protocol is, you smile, you look towards the person who is there in front of you, you smile, and then greet the person by saying namaste. Some hospitals, they do have their greeting protocol as good morning, good afternoon, good evening, good night, but good night you cannot say. That comes across in a negative way. However, from the Indian context, since good morning, good afternoon, good evening, they have limitation in terms of the time of the day when you can use these greetings. Namaste is something like our own Sanskrit word, which means hello. The way in English we say hi, hello, something similar. Natamastak hona. So we bow down to the other person by showing our respect to the other person. So especially in healthcare industry, lot of emphasis is given on the greeting protocol, wherein you need to connect with the patient, you need to connect with the person or the people who are there in your system to avail the treatment. And that starts with the greeting protocol, which is namaste with a smile. Now, why we need to smile? Can anybody answer why we need to smile? Excuse me. Why we need to smile?
It's a
Because it doesn't
positive
cause
gesture to the other person.
Good gesture.
Okay, okay. What else? What else?
Positive impression of the hospital.
Okay, okay. So,
To,
like, let's say,
to reduce anxiety, to make them familiar.
okay, okay. Very nice, very nice. Anybody else would like to answer?
So smiling enhances positive emotions. So I think it's really important because it
Perfect,
doesn't
perfect.
cost at all. So we can smile at any time. Yeah.
Agree, agree. Good answer, good answer. Thank you, everyone, for the answers. Now, as all of you all mentioned, that's one of the aspect. The second aspect is, you can try this, you can challenge me anytime if it is wrong. Okay. Aparna has my number. You can always challenge me if it is found to be false, but it's not false. Every time you are stressed, doesn't matter in which industry you're working, doesn't matter in which role, doesn't matter what your hierarchy, work experience, designation is. Every time you are stressed, you're not in the right frame of mind. Maybe you're thinking about your family back at home, what's happening, you're thinking about money problem, financial problem. And especially when you're in service industry or hospitality, it's very important that the negativity that you have, or the thought process, the thinking that you have in your mind, doesn't pass it on to the other people who are around you. And especially when it comes to hospital setup, wherein we have patients who themselves are in pain, they are suffering from something. When we, as employees of the hospital, when we interact with them, we should always be coming across to them in a welcoming way. And that's where, when we smile, first it helps the person who is smiling to let go of whatever thought process which was negative in his or her mind. So it's like, let's say your system, that is your computer, your laptop, let's say it's not working, it's not functioning, it hung up. What you do is you restart it, you reboot it, and then again it starts functioning properly. We also do it for our smartphones. Something similar happens. So every time you feel stressed, you're not in the right frame, doesn't matter whether somebody shouted at you few seconds back or you shouted at someone few seconds back, it doesn't matter. If you want to change your thought process, if you want to come across in a positive way, the very first thing that you should do is smile. And trust me, when you smile, whatever you were thinking, it goes away. You feel refreshed. And with that smile, when you greet the other person by looking into the eye of the person, of course, you don't have to stare, but a warm look towards the other person, you smile. And when you greet the other person as saying namaste, it always creates that momentary rapport with the other person, and it always gives respect to the other person. So that's one of the key thing. Second, for the person to whom you're greeting, for them it's a welcoming tone, it's a positive kind of a reflection, and they would feel that yes, there are people out here who are concerned, as against to a situation wherein, like, let's say patient comes to the reception area and the staff member out there doesn't greet the patient, and the staff is busy operating his or her system, or maybe they are chatting on WhatsApp. So that doesn't give a positive connect. So emotions are the key. So every training that we do in the hospital setup, be it technical, be it non-technical, we always emphasize on ensuring that our emotions are well in check. Our negative emotions should not reflect to the other person in a negative way. We need to balance that. Now, these are some of the common emotions. Of course, we discussed earlier there are more than 8 emotions, and considering the combination could be as high as 65,000 plus variants. Now, what we are going to do out here is I'll request everyone to kindly come on camera, turn on your cameras. We'll do a small, quick activity out here. We do have time, we are on time rather. So, let's do one small activity. So there are 4 emotions: anger, fear, sad, happiness. Now, what I'm going to do out here is, has everybody turned on the camera?
Yeah.
Perfect, perfect. Now, the moment I say about a particular emotion, like let's say if I say sad, all of you all should show that emotion to me in terms of that you are sad.
Okay.
Is the activity clear to everyone?
Yes. Yes.
Perfect, perfect. And don't feel shy. All of us are here. We are in the same boat, going through the same session. The first emotion is anger. Anger. So, by looking at you, I should understand that yes, the person is angry or highly irritated. Very nice, very nice. So, with anger, we cannot smile. Okay. So, we have to keep a check on that. Happy, happiness. Person is very happy. Change your emotion. You should come across like you're very happy. Now, often what happens is when we are happy, at times we tend to smile. And at times when we are very happy about something, we might also giggle. At times we might also laugh. So the boundary line between smile or being very happy and, let's say, ensuring that we don't laugh is that we are in a healthcare setup. Patients who come to us, we need to smile when interacting with them, but we cannot laugh, because if you laugh, they would feel offended. So that's one of the balance that we need to maintain. Third emotion is fear. By looking at you, I should feel that you are afraid of something. And how do you make that visible in terms of your facial expressions? Can anybody answer? How do you make the other person know that you're afraid of something without speaking? So when you're
With
afraid,
your
what happens?
body
Yeah.
language.
Okay.
Body
But let's say,
language.
Body language,
Like
correct.
this.
But
No eye contact also. Sometimes when you're afraid, you can't make an eye contact with the other person too.
possible. But often when people are afraid, when they are scared, often their pupils are dilated, right?
Dilated.
They try
Yeah.
to bulge.
Yeah.
And often we are looking in one direction. At times they might be shivering. At times they might be shivering. At times they might be so scared that some people faint
They
also.
go
I
back.
mean, they
They go
are
blank.
unconscious. They go blank also. Exactly. They don't know what to say, how to react, what to speak. And
Exactly.
the
True.
fourth, yeah, and the fourth emotion is sad, sadness. Now, by looking at all of you all, I should be in a position to know that all of you all are sad. So it should reflect on your face that you are sad. Very nice, very good, perfect. Now, why is it that some of you all are looking downwards? When I
Same.
said you have to show sadness, why is it that you guys are looking down, diagonally downwards, maybe on the left hand side, maybe on the right hand side?
Maybe because we are demotivated.
Okay, that could be one thing.
The lack of confidence.
Okay, okay. What
The
else?
person don't want to interact with anyone.
Okay, okay. And that's how we try to avoid eye contact,
Me
right?
too. Eye contact.
Yes, sir.
Yeah, yeah. So, of all the emotions, I mean, you can observe this behavior among all the people. Whenever a person would be really sad or is going through bad phase in his or her life, often when people are thinking or they are in their own thought process, people tend to look down. And especially when somebody has experienced loss of a family member or a relative, those are very strong emotions of losing someone, right? And when you
Yeah.
see somebody, especially during, let's say, condolence meeting or prayer meeting, you'll see that
Mhm.
everybody would be looking downwards because probably a lot of thought process is going on in their mind. So similarly, what happens is when we work within the hospital setup, when patients come to us, a lot of emotions are going through their mind. They might be sad about their family member. They don't know what's going to happen to their family member, although the family member is undergoing treatment. Often, especially in terms of cancer, what might happen is treatment is done, everything is fine, but after a couple of years, again, cancer might relapse. So in such cases, again, the family members might be worried. So, especially the context out here is as employees, as staff members, as human beings, most importantly, as human beings, doesn't matter whether you're working in hospital setup or not, wherever you are working, in whichever context you are, you should always ensure that the surrounding environment should not get spoiled because of your own emotions. If you are angry, if you have problem back at home, that anger should not reflect on your staff members. That anger should not reflect on your colleagues. Similarly, in hospital setup, when our staff members, when they interact with patients, often patients are angry, they are irritated. Just because the patient is angry, they are irritated, our staff member cannot speak to the patient in that similar tone. That's how it is. So we train our employees highly on maintaining or balancing or regulating their emotions, irrespective of how the other person would behave. And this is the most basic fundamental thing that I think all of us we should do as human beings also. Whatever problems you have, doesn't matter. When you are there at the workplace, ensure that because of you, the surrounding environment should not get spoiled. Moving on, replace negative emotions with positive emotions. And I gave you the trick. Every time you're feeling down, you're feeling low, you're feeling demotivated, that's the best time wherein you smile. By smiling, you may not have the end result or you don't have the solution, agreed. However, it will clear your thought process wherein you can think in a much more better way. So ensure that you replace your negative emotions with positive emotions. Now, in terms of specific training programs, which are very common across healthcare organizations, these are the ones. So, mandatory trainings like fire and safety, basic life support, induction training, especially when a person would join the organization, he or she will have to undergo induction training. Refresher training is like yearly once every employee who is there in the process, he or she will undergo policy refresher training so that they are aware about latest modifications or add-ons with regards to the policies. Second aspect which we have been discussing all this while is about patient-centered care trainings. Patient centricity, patient centered care, people centered care, all these things talk about patient being at the crux of whatever you do. So, for example, let's say I'm a housekeeping person, I sweep the floor, agreed, but still I need to do that considering whatever I'm doing, it's from patient perspective. I am, let's say, chief operating officer. I am CEO of my company. Whatever I do, whatever work I do, whatever reflections would be out of my work, it will again correlate with the intention that I have. That is, patient should always get a good treatment. The care facility should always be appropriate to the satisfaction or to a positive experience of the patient and the family members. So, if somebody within the hospital setup, any employee who is not doing his or her work, eventually it will always impact in patient care. That's how the correlation is. So when we talk about patient centered care trainings, the common ones are soft skills. Soft skills could vary in terms of interpersonal skills, communication skills, problem solving skills. It could also be in terms of behavioral skills. As we discussed earlier, let's say patient is angry, very rude with you. So in such cases, you cannot give it back to the patient that way. You have to apologize for whatever dissatisfaction the customer had, patient had. Try and understand what went wrong, and basis that you try to provide the solution. We also have training programs which are related to customer centric approach. How to ensure that your services are best in terms of the offerings that we offer. And while doing so, grooming is one of the most critical element. How well you are dressed up. And grooming is not only about your uniform, but the way you carry yourself, the way you approach, the way you greet, the way you talk, your hair. Everything is important from grooming perspective, because that's how you create a positive impact. So when patients come to hospital, when they see people, let's say, casually dressed, especially staff members, the important thing that will happen out there, which is negative for the hospital being, when patients see people or staff members who are not well groomed, they will lose confidence in the hospital offerings, especially in terms of treatment. And that's the reason you'll see across all the hospitals, be it in India, internationally, you'll see hospital staff members to a greater extent, they'll be well groomed. You might see instances wherein people are not groomed or they are not in the attire that they need to be. And especially that happens when they change their duty time. So often there would be overlapping time period wherein people from one shift, they step out of the system, and there are people from another shift who come into the system in terms of their duty hours. And that's when you'll see the staff members in, let's say, their casual dress or uniform or whatever they are wearing. So that's the only difference. We also offer process trainings, and again it could be in terms of policies, procedures, tasks that we have. Like, since we are there in India, all Indian companies, they have to follow certain protocols. Posh training being one of the trainings that is a mandatory thing in India. So all those trainings are also part of hospital setup. And of course, we do have leadership development programs, or we often term them as capability development programs. Now, these essentially would be for people who are, let's say, managerial level, mid managerial level, and top CXO level people. So, for them, again, there would be a different approach in terms of how we groom them. Any questions so far, anyone?
I have a
Any?
question.
Yes, yes.
May I?
Yes, yes, yes. Please go ahead.
You said wonderfully that, yeah, you mentioned, since you work in the area of hospitality, we cannot show our angers, our mood, anything at workplace, which is very important. And you gave lot of trainings related to self-regulation. So how do you train your people to manage their emotions so that it will not impact your other staff members or patients? Because believe me, we all have gone through this. Unfortunately, some of our loved ones need to be in the because they want to go home, and they take out their emotions on staff
Right, right.
very badly. But staff doesn't respond in that way, and staff shows huge level of patience. So how do you train them on that? I hope this question will be interesting for everyone. Let me know in the chat box also, right? Good, Amit,
Ma'am, this
please. Thank you.
Uh,
Yes, Amit.
sure. So thank you for asking that question. It's a wonderful question. So essentially, in a healthcare setup, what happens is, barring the new joiners who have joined very recently, who don't have the experience and exposure, at their level, at times they might show certain signs of distress, especially when the patient or when the family members are yelling at them, shouting at them. At times, it might happen. But in terms of how we groom them, what we do is we do a lot of role play activities. So, like, let's say there is one team who is behaving as the patient side, or let's say the family members of the patient. And let's say we take a small example, and which is one of the most common example, wherein most people, even all of us at home in our respective homes, we all complain, and that is food. So let's say person X who is married, the wife prepares food for the person and the person is unhappy about it, and the person gives a feedback. So the way it happens in our respective homes, similarly it might also happen at a workplace, right? So similarly in hospital setups, often what happens is patients who are hospitalized and they are undergoing medication and doctors have prescribed them a proper diet along with the dietetics or dietitian, patient cannot eat anything else apart from what has been recommended to the patient, because it will act against the treatment. But what happens often is patients who are bedridden for a prolonged duration time period, they often lose their taste, they lose their patience, and they often yell and irritate the nursing staff members. But then the way we train them is we always sensitize them, we always sensitize them about all these situations well in advance, so that it doesn't come across to them as a surprise. So for example, the context which I mentioned, patient complains about food is not good. Now patient might say I want to eat chicken biryani, and there are scenarios wherein people do say that, patients do say that, and patient might crib to the family members, and family members might crib further to doctors or nursing staff members saying that our patient wants to eat chicken biryani or whatever it is, please arrange for it, and we don't know anything, and the patient is desperate to have it, otherwise we are going to step out of the hospital, we are going to go to some another hospital. So all these scenarios happen, but what we essentially try and tell our staff members is all these situations are common, you're going to experience them, but to give them exposure, we do a lot of role play. So as I mentioned earlier, let's say we form two teams. One team, let's say there are 5 to 6 people, they are going to act as patient and the staff member, and we give them 5 to 10 minutes time period. For example, you go and prepare whatever concerns you have, you have to simply blast the other people, while on the other hand, the other group who is trying to act like, let's say, hospital staff members, they are told to simply act and react to how and what the other team is going to say, especially the patient side. And once that role play, let's say, starts, as a trainer, as L&D people, we observe what's happening. Now every time we do this kind of a role play, it's not that every time it is 100% perfect in terms of what people need to say, what people need to behave, their body language, how they need to respond. Every time it doesn't happen that way in a expected way, but that's how we keep doing the same thing again and again. In terms of what is the protocol, what are the concerns, the very first fundamental thing that we tell people to do in such scenarios is to apologize. Doesn't matter whether it's your mistake or their mistake, apologize. In most cases, 60-70% of the cases, when you apologize to the other person, irrespective of whether it is their fault or your fault, the other person would be keen to talk about what their concern, what their problem is. In most cases, I'm not saying in all 100% scenarios. After you do that, you ask them, you request them how you can assist them. As far as possible, we tell our staff members not to use the word help, HELP, help. Avoid using the word help in healthcare industry, because often people consider help as a negative word. They think that, do you think that I can't help myself? That's how people often respond or react. So we always train our staff members to say, to use the word assist. So if you're going to speak in Hindi, you're going to say, मैं या हम आपकी क्या सहायता कर सकते हैं. सहायता, that's the right word. If you use the word madat, again it goes back in a negative way. Now especially we train our staff members in terms of conflict management. There are various models in the market. The most common one is Thomas Kilmann model. So we train our staff members on how to regulate your emotions based on the conflict that's happening. At times people are able to do that, at times people are not able to diffuse the situation, but when you provide them the solution, in terms of the problem that they have, if you try to provide the solution, in most cases again those kind of concerns, challenges might get resolved. In extreme cases, it might so happen that, let's say, the staff member is a junior staff member and they're not able to manage the situation to a greater extent, and the family members and, let's say, the patient, they are also large in numbers. Like at times, let's say, one or two people who are hospital staff members managing 10, 15 patient side members, at times it does become difficult situation. So in such cases, what might happen is the patient side might say, we want to talk to the manager, we want to talk to the senior staff members, or the staff itself might suggest, do you want to meet the senior people, if in case you have a concern or you want certain things to be addressed, I can assist you in that to diffuse the situation. So in all these ways, we are able to diffuse the situation to a greater extent. One of the common thing which often patients do is they always try to threaten. You don't know who I am. You don't know who my contacts are. तुम जानते नहीं हो मैं कौन हूँ, कहाँ से हूँ, मेरी यहाँ तक पहुँच है, and so on. People often try to threaten, or people often try to threaten by saying that I want to talk to your manager, I want to complain about you. In all these cases, the fundamental thing that we always try to tell the other person is by saying, by apologizing. You extend your apologies and then you take the conversation ahead in terms of what the concern is. Yes, later on, the staff members do feel bad. And often they say that it wasn't my mistake, it was purely their mistake. But the important thing is, at that particular point of time, you cannot vent it out unless it becomes a physical kind of a situation wherein, let's say, they probably, let's say, try to slap the hospital staff member, they try to act in a very rude way by giving bad words. So in such cases, there are certain protocols that we follow internally. However, in most cases, we are able to diffuse the situation. So we essentially sensitize people for all these situations. Another example would be fire safety. Let's say there is a fire in real scenario. There is fire. How exactly you are going to evacuate? In such cases, people are going to panic. People might not shout back, but people are going to panic. So we train everybody on all these protocols. In hospitals, we have something called as emergency code. So every time there is an emergency, for example, let's say a patient collapses. Now we cannot say that patient on a particular flow in a certain department has collapsed. We cannot say that, because the moment we say that, people around, patients around, they would panic. So within the hospital, we have a code called as code blue, and we also have a mic system within the setup. So we announce code blue, we mention the location, we mention the exact you can say area wherein that incident has happened, and the moment it is announced via a certain protocol that we follow within the hospital, doctors, nursing staff members, and other support staff members who are supposed to work or act on that particular code, they'll rush to that particular area and they'll do the necessary intervention. So that's how the entire process is managed. So what I'm trying to say is, for most of the situations which might happen, especially from patient perspective, we provide those role play trainings to our staff members on a frequent basis. I hope I have answered your question, Aparna.
Yeah,
Yes,
Amit, I would
yes,
like
thank
to
you.
add one more thing over here. What I used to also do is allow them to ventilate in group sessions. You know, when we have our small groups, you know, the department groups and all, we ask them what are the situations they have faced and how they have handled. So each one learns from one another, and also at that point of time, allow them to ventilate their anger, so that they
Agreed.
don't carry it back home and affect their own personal lives. Because when in healthcare sector, basically, even the people are involved, the staff members also get lot of emotional involvement, and then they get affected personally. So to avoid all that, ventilation and a kind of, you know, support system from the seniors is very essential. So that is another part we used to also have apart from the role plays.
Totally agreed. Totally agree.
Nice
There are
talk, Amit.
multiple. Thank you so much. Totally agree with you. So there are multiple interventions, but then this is one of the things that works
Multiple.
wonderfully.
Yeah.
Apart from this, what we also do is we do art therapy. So people who are irritated, angry, not every person reacts the same way after diffusing the situation. So when they come back to their department, or when they're talking to their colleagues, or let's say superiors, often they try to vent it out, as you rightly mentioned. So we do insist that, okay, fine, you vent it out, or here's a crayon box, here's a sketch pen box, just vent it out in terms of some drawing, some color that you want to use, and do a sketch or write something. So there are different ways in which it can be done. In worst cases or in extreme cases, we do also counseling part, because at times what happens is people feel that I'm being targeted by so and so patient. Every time I go there, every time they say something. So in certain cases, patient staff, the nursing staff members, they're not keen to go and meet the patient or attend to that particular patient in extreme cases. So in such cases, we also do counseling services to them. We also have psychologists internally. So there are different ways, but thank you for the answer.
Yeah, and also you can have mentors. You can appoint mentors for a group of people to whom they can approach for support. So that's another
Absolutely.
thing I used to do also. Yeah.
Very nice. Very nice. Very nice. So any other input? Anyone?
I think we are good to go, Amit.
Okay. And this is the last slide. Apart from the
Okay.
usual trainings which happen within the healthcare setup, some of the trainings also happen in other industries, other sectors. But something that's very specific to healthcare industry is preparation for accreditation. So especially when we talk about India, we have accreditation body called NABH, National Accreditation Board for Hospitals and Healthcare Providers. So what happens is every hospital that is there in India, they need to follow certain guidelines, they need to follow certain rules. I'll give you a parallel example. All of us, we are aware about RBI, Reserve Bank of India. So it's the governing body for all the banks in India. Similarly, NABH is the accreditation body as well as the board for hospitals and healthcare providers in terms of governance. What are the things that should be implemented in the hospital concerning patients and concerning organizational employees and other setup related aspects? So what hospitals would do is they would go and apply for NABH accreditation. So it's like saying your hospital has NABH certificate, which itself adds value. It's like the way for, let's say, food items, we have AgMark. For ISI, for appliances, we have ISI. With regards to ProTouch, we have HRCI, we have HRC, SHRM, we have ICF. Correct me if I'm wrong, Aparna. So all these are
Absolutely
accreditations
right.
which, yeah. So all these are accreditations which add value to the hospital because it reflects quality assurance. That's what NABH does. Similarly, at international level, there is JCI. JCI is prominently based in US, but then they do accredited hospitals across the world. And NABL is essentially for laboratories. So, like you would have read the reports with regards to NABL accredited lab, especially during COVID times. So this is mark of benchmark, or you can say standard of quality in terms of the services which are offered by that particular setup. So if you're going to a particular hospital which is having NABH accreditation, so what essentially it means, it's a hospital wherein the quality standards and measures are as per what NABH provides, because there is a proper scrutiny in terms of NABH accreditation. Similarly is the case for JCI and NABL. So this is one of the training wherein L&D people across the hospitals, they prepare the staff members. Of course, training is not just one of the component, but then there are other parameters which are called as standards, which are also called as elements. What are the things which hospitals need to maintain in order to ensure that they get these accreditations? So those are the guidelines basically. So this is the crux of the entire conversation today that we were looking forward to. If you all have any questions, feel free to ask your questions.
So, Amit, you can stop sharing your screen, please. Yes, any questions? Though we have actually crossed the time. Any questions anyone has?
I have two questions without consuming a lot of time. I'm just go quickly. First thing, Amit has mentioned leadership development program, like capability development program. How this leadership development program is different from others industry when we are focusing on healthcare? And my second question is, how, as you are training a lot of other technical, non-technical healthcare and CEO till, so how do you measure the effectiveness of this training?
Okay, okay. Thank you so much for those two questions. The first question is, leadership is common across the industries in terms of the way people consider leadership to be common. However, the different element out here in healthcare industry is more in terms of the competencies. So as an organization in my own company, or even if we talk about other hospitals, every company will have their core competencies that need to be there within the process. So for example, like let's say being empathetic, for example, driving results. So these are some of the competencies, business acumen or innovation. So each company has competencies. So at top level, you understand to what level the existing CXO leadership is in line with the existing competencies, what you want to develop, and if you are planning for, let's say, succession planning, how you're going to build that particular gap or bridge that particular gap to scale them to ensure that your business also runs, your patient care also happens, and at the same time, your leaders scale up to the expectations. So everything revolves around competencies. In terms of framework, largely the framework would remain the same. But what determines the differential part is the competencies. And the second question, I'm so sorry, I forgot. What was the question?
My question is, how do you measure the effectiveness of the training? What we have, already done with the staff, whether it's role play or the L&D program for CXO level, or for the nursing staff, or for the patient care staff.
Okay, thank you so much. Fabulous question. So what we do is immediately after the training is done, we do take the training feedback. But one of the peculiar thing that happens within hospital industry is we always have something called as pre-test. Pre-test followed by training, followed by post-test. There would be evaluation. Feedback would be taken for the training program, for the content, as well as for the trainer. And since it's healthcare, what happens is every time the person would be there on the floor, we also take inputs from the departments, departmental heads, and people who are there in patient areas, especially nursing staff members. We also get the feedback about that particular process from the patient in terms of NPS, Net Promoter Score. So a score which is 9 and 10 is a good score because that's a promoter score. A score that is less than, let's say, 6, that's a detractor. That's wrong. That's not good. And something that's 7 and 8, that's like a neutral thing. You can convert those people to the higher side. So every time a training is done, we map that person's performance at least for a period of 45 days to 90 days, depending on the department. And that's how we try to correlate to a greater extent. I hope I have answered your question.
Wonderful. Thank you so much. I got it.
Any
You,
other
Ameet.
question, anyone?
Amit, I want to add one more thing. We have something called patient feedback forms also in hospital where we come to know about the behavior of the staff. So that's another marker where we understand how effective our training has been in spite of the iteration and other things of the staff. So that's another marker we can always depend on, to look at how well our training programs have been to the staff.
Absolutely, absolutely. So what we do is we have tabs at various points. People can go and share the feedback anonymously. So that's all from my end. Aparna, anything from your end?
Yes, I have a lot from my end because it is 8 o'clock or almost
Yeah,
8:15.
yeah.
And you can see the energy amongst the audience. They are so excited. It is so much positive energy is there. There are few people have left, however, they have mentioned so good that a lot of learning has happened. So, Amit, understanding about the L&D part of healthcare is one. But most important is, I think each one who are attending this session here will respect the healthcare staff more.
Totally agree.
And I'm literally feeling moved right now that especially during COVID time, I think healthcare industry has worked like a soldier's army for them. And I don't know what all things healthcare people have taken up. I think this is somewhere, especially here in India, we have become extremely demanding customers. When we go to hospitals, when we go to hotels, when we go to, salons, I think we expect a very high level of services. And if we don't get it, we don't think that we are talking to human beings. I think what we take from your session today about learning and development, how you're training people, you know, the techniques which you have shared, role play. I think Jyoti has also shared wonderful techniques, venting out. I'm just thinking about what can be the mental health as far as the healthcare is issue. I promise from my end that I will make sure my emotions will never come out on healthcare and hospitality staff. And I will always respect the services and the kind of efforts people like you who are investing in your staff, team, right from security guards to all the doctors. I think you have not given us only L&D lessons, but you have given us today the lessons of being human. I can't thank you enough, Amit, for such a wonderful, heart-moving sessions. Thank you so much.
Thank you so much, Dr. Aparna. Just a parting thought. The crux of whatever we do, doesn't matter the industry, is the connect, the communication. And I always tell people, irrespective of my team or the hospital staff members, start with your home, talk to your family members the right way, positive way. Food is not good, doesn't matter. You don't have to really vent it out. Lot of things can be taken care of if people manage their emotions. And the fundamental thing is, start with your home, start with your colleagues, rest other things will automatically follow with practice. Otherwise, we all study, we are all literate, we all do double MBAs, double graduations, but the basic sense that we lack is common sense in most situations. And fundamentally, especially in healthcare, because we see a lot of pain, lot of grief around, we have to be highly mindful about our emotions. And if we are able to do that, most other things roll it out. Like even being there with a patient and not saying anything means a lot to the patient, because they consider that, okay, somebody is there with me listening to my pain and grief. So at times being there is very important, rather than having a very wood kind of a face wherein you're like trying to act very macho, very bold, but then you're not acting on the things that you need to do. That's all I wanted to add, Dr. Aparna.
Great, great thoughts, Amit. I will say from such a busy schedule, you have taken out time for us. I will be an entire team of ProTouch, all the participants here will be always thankful to you. Thank you. And it's my promise to you, whenever I will be in Bangalore, we will certainly catch up. Thank you.
Thank you so much, Dr. Aparna. Look forward to catch up with you. And thank you to all the participants joining in for this particular call, especially after your busy schedule. Keep smiling, and always remember, happiness is more about the way you think. Happiness is a state of mind. Thank you so much.
Thank you. Thank you, everyone. I hope you had a good session and great learnings. Thank you so much, everyone. Thank you.
Yeah. Thank you and good night to all.
Thank you, ma'am.
Thank you, Amit.
Thank
It was
you
a
and good
wonderful
night.
session. Thank you.
Thank
It
you.
was a wonderful
Thank you.
session.
Thank you.